in today's video, we are going to go over Cushing's. So Cushing's is disorder of adrenal cortex. The adrenal cortex is responsible for making 3 hormones. Those 3 hormones are glucocorticoids, aldosterone, and sex hormones. It's estrogen and androgens. We're going to talk about what those hormones do. The first one, glucocorticoids, are responsible for glucose, for sugar in your blood. When you have Cushing's, you have too much sugar in the blood. And you have aldosterone. Aldosterone is responsible for salt in the body, also known as sodium. And in Cushing's, you have a high level of sodium in the body. So we're going to get into the manifestations. Cushing sounds like cushions. So I want you to keep that in mind as we're going through the manifestations. So some of the manifestations are, if you think somebody who has a little bit more cushion on them, what's that look like? They're a little bit more plump. When people tend to gain weight, what happens? You get purple striae or stretch marks. Get a little neck hump. They also call it buffalo hump. Then you also have weak and brittle bones because, like we talked about earlier, you have high levels of glucose. And when you have high levels of glucose, that causes your bones to become weak and brittle. At risk for infections, hirsutism, also known as male hair or coarse hair. Think about these manifestations. Think about the hormones that we talked about. When you have the sex hormones, if you have estrogen, androgens, if those are out of whack, then you're going to be more susceptible to things like male hair, especially if you're female, because Cushing's is predominantly found in women. It's actually just found in women ages 20 to 40. Weak and brittle bones. We talked about glucocorticoids, and that means the level of glucose in the body is dysregulated and you're going to have more of it, and that breaks down the bone. So then osteoporosis, weak, fragile bones, that can help you tie those things together. Lab values. You're going to have high levels of salt in the body. So what does that do to the blood pressure? It increases the blood pressure. You're going to have, again, high levels of sugar. So you're going to have high glucose levels. And then you'll have low potassium and low calcium. Again, if you remember bones are weak, brittle, you're going to know that calcium is also going to be low. High levels of sodium, you're going to have potassium excreted. Diagnostics is a saliva test. And that just tests how much cortisol you have in the body. If they are on steroids, talk to their provider about lessening the dose or tapering off. Because remember, if you taper off, you run into something like Addison's. Outside of that, one of the other things that causes high level of cortisol, we're in the pituitary gland. Sodium, also known as Na. If you think of the N in Cushing, remember, Cushing, okay? Up, it's going to be up. That value is going to be up. And then right after N, you have G in Cushing. So G, Cushing, up. N and G, up, okay? Remember those things. And then the calcium and potassium are opposite. We're going to go over a couple questions. This one says, a nurse is planning care for a client who has Cushing's disease. The nurse should identify the clients who have Cushing disease are at an increased risk for which of the following? Select all that apply. Your favorite question. A, infection. B, gastric ulcer. C, renal calculi. D, bone fractures. Or E, dysphagia. We're going to have an infection. Yes. Because when you have too much glucose in the body, too much glucocorticoids in the body, it puts your immune system at risk. Gastric ulcer. So if they're at increased risk for an infection on the outside, inside, gastric ulcer, kind of makes sense, right? Next one, renal calculi. Don't have anything to do with Cushing's. D, bone fractures. We talked about this. Too much glucose in the body makes you at risk for bone fractures. But then again, too, we talked about the calcium was going to be low. And if you have decreased calcium, the dysphasias, when you have trouble swallowing, has nothing to do with this. Next question. At the beginning of a shift, a nurse is assessing a client who has Cushing's disease. Which of the following findings is the priority? This is not select all apply. This is a priority question. So which one of these is most important? A, weight gain. B, fatigue. C, fragile skin. Or D, joint pain. Keep this in mind. When you have a priority question, Mostly all the answer choices are going to be right, but which is priority? Then you have to take into account airway, breathing, circulation. It's weighing. Because remember, somebody with Cushing's, they have hypertension, high levels of salt in the body. Usually when you have salt in the body, guess what happens? You're swollen, you're big, you're cushioned. Remember all these things. This is going to help you when making these answer choices. So if somebody has more water weight on them, what are they going to do? They're basically going to drown. There's at risk for things like pulmonary edema, cardiac issues. Keep that in mind. Number 3, a nurse is reviewing the laboratory findings of a client who has Cushing disease. Which of the following should the nurse expect for this client? Select all that apply. My favorite type of questions. A, sodium of 150. Normal sodium is 135 to 145. So here we have a sodium level of 150. B, potassium 3.3. Potassium is 3.5 to 5.0. C, calcium 8.0. Normal lab value for calcium 9 to 11. 911. Lymphocyte count 35. Or E, fasting glucose of 145. All right, so before you answer this question, I want you, sometimes you need to take a moment, write your lab values down, write down what you know. With Cushing's, remember we said NG, Cushing's big, they're gonna be up. So your sodium and glucose are up, write that down. So then your potassium and calcium are going to be low. Remember, those are opposite. So we have sodium, which is 150, that's high. It's above normal. 135 to 145 is your range. B, you have a potassium of 3.3. We talked about potassium was going to be what? Low. 3.5 to 5 is your normal value. We have 3.3, so it's going to be B as well. C, calcium 8.0. Normal calcium is 9 to 11. What do we say calcium was going to be? So we have calcium of 8.0, normal calcium 9 to 11. So C is also an answer. D, lymphocyte count of 35. No. E, fasting glucose of 145. Yes or no? Yes. Why? What is the normal fasting glucose range? 70 to 105. So anything over 105 fasting. We're going to talk about foods that are high in potassium because that is something that will get brought up. They have the ending O's, like avocados, potatoes, tomatoes. Hope you guys enjoyed this video. If you want to see more videos or have a topic that you would like to go over, comment down